Good afternoon, everyone. My name is Marisette Hassan, and welcome to day three of our virtual symposium being hosted by our coalition here in South Carolina, the South Carolina Coalition for the Care of the Seriously Ill, which we call CSI here in South Carolina. We are grateful to have each of you on with us. We know there's probably a few more people that will be joining us. But wanted to, for those who may not know about our program, we are 16 years old this year. We were founded in 2010, and really we were founded as an outreach committee of the South Carolina Medical Association. The Bioethics Committee saw a need to have a coalition such as this. And we have our very first project was to work on POST for South Carolina. And we were able to, after doing a pilot for 3 or 4 years with Department of Health and Environmental Control, we were able to get it legislatively adopted for statewide adoption in 2019. We also are very engaged in advanced care planning programming and have done some grassroots work across the state funded by the Blue Cross Blue Shield of South Carolina Foundation. And we are recently, our next policy work is to really look at palliative care and how we can improve our palliative care ranking based on the rankings done by CAPC with the palliative care scorecard. So we do a lot of education, not only with clinicians on how to have conversations, but also with community stakeholders. We meet once a month on the third Wednesday of every month, and it is an open group. There is no fee to be a part of our group. And so love the fact that we have healthcare systems, hospice programs, palliative care programs, and community stakeholders who participate with us. And of course, every month there's a topic where we dive into the serious illness care continuum. This symposium, we've been hosting it for a number of years now, virtually, particularly since COVID happened. And it is a way for us to really look at some of the other different areas. Last year, our committee wanted to focus on advanced heart disease. And this year, we are focusing on oncology care and looking at how we can transform cancer care through collaborating and partnerships. So excited about that. Want to give a shout out to the committee members. So grateful to have Jessica, who is our administrative executive assistant extraordinaire. She does everything behind the scenes. Nobody knows all the work that she does to help us get things going with the promotions and evaluations and the Zoom, all of those things, registration. And then Carrie, thank you so much for being a part of the education team. Tracy Fasolino, Laurie Libran, and Lauren King rounds out the group. And so they've done a tremendous job in helping us secure some amazing experts for this week. And so I am now going to turn it over to Carrie because Carrie is the medical director for Agape Care, a community-based palliative care program here in South Carolina. They cover all of our counties. Now, listen, I know we're a small state, but 46 counties, we are happy to have palliative care in all 46 of our counties. And so Carrie is the one who leads the ship for Agape related to those things. And Carrie, we're so glad that you're going to be our moderator today. So I turn it over to you, ma'am.
Yes, thank you. Thank you for that introduction. And as you said, I'm Carrie Bradford. I am a doctoral prepared nurse practitioner, hospice palliative certified. I did direct face-to-face patient care for a long time in the community, near and dear to my heart. So to be able to lead a team who is also doing this work is just phenomenal. So that is my intro. Couple of housekeeping before we get in. Introduce yourself if you haven't already in the chat box. We love to see who is here, your role, and where you're from. We will allow time for questions at the end of the presentation, but we will have someone monitoring that chat box. So feel free to go ahead and put questions in. And at the end of the session, please complete our eval. We'll send out a QR code at the end. And I would not be doing us a service if I did not tell you, please do not forget to join that wrap-up session tomorrow for pain management and holistic supportive therapies with Dr. Judith Pace and Michelle Robinson. So I want to go ahead and introduce our speakers. So today's topic is patient and caregiver resource and support. And in a minute, I'm going to kind of tell my little piece of why and just how all this group, this panel came together. It was really cool when we were talking and prepping, and really excited for what's to come. So without further ado, we have Tiffany Fountain. So she is the Associate Director of Cancer Center Partners for the American Cancer Society. She collaborates with accredited hospitals, oncologists, community partners to expand the access to cancer services across the care continuum. She's a skilled relationship builder. She fosters collaboration among diverse stakeholders to strengthen partnerships and ensure critical resources reach the underserved population. So, Tiffany, so excited. Our other guest panel speaker is Dr. Chrissy Sally. She's a psychologist specializing in support for patients and caregivers of children with complex medical needs. As a director of the clinical education engagement of the Courageous Partners Network, she develops resources and programming to support patients and clinicians caring for the seriously ill children. She's active in the Society of Pediatric Psychology, and she co-authored the Standards of Psychosocial nationally and internationally to improve experiences. She works, nationally and internationally to improve the experiences, and she's published on multiple of these topics. And last but not least is Amy Graver. She is our guest star today. We could not be more thankful for her joining us. She is a bereaved mom. Her daughter Lauren was diagnosed with rhabdosarcoma at the young age of 8, and we lost Lauren just after she turned 10. So Amy is here as a parent who is still grieving, and she really speaks to the importance of finding resources through this journey, not only for Lauren while she was going through this, but for her husband, for her children, and for herself. And not only during that time, but still today, needing that support that we're going to talk about today. So really excited for this. As I mentioned, this group came full circle. I have 7-year-old twins, and when they were born, shortly after birth, we received a diagnosis of Beckwith-Wiedemann spectrum. For those of you who don't know, puts children at high risk for cancers. And we screen them currently every 3 months to preventively make sure we catch anything early. And so we have been blessed that we have not gotten a diagnosis, but the fear that was there when we got the news, the fear that comes in anticipation of these screenings and scans, I wasn't okay. Right now I'm on a different spot, but as a parent getting that news and not knowing where to go, not knowing the resources that were out there, I was lost. I worked in palliative care at the time, and in my head, I could only think of the families and the patients I was taking care of. I remember reaching out to my mentor and saying, I can't do this work anymore. But ultimately, I found who I needed to help me get through this, to help me and my family support it. And so hearing Amy's story is so touching, and then the work that Chrissy and Tiffany are doing. So again, it really just brought us full circle on the importance of this topic and getting the news and the resources out there. So I'm going to let everyone just do a quick, this is going to be open discussion panel style, but I'm going to go through each of you guys just to do a brief, tell us a little bit more outside of that introduction before we get into the questions. So Chrissy, let's go ahead and start with you.
Thank you, Carrie. As Carrie mentioned, I'm a pediatric psychologist by training, and I have been with Courageous Parents Network now for nearly 4 years. My interest in supporting parents of children with medical complexity began over a decade ago now. My background and training is in pediatric cancer, and so I did that research for a long time and really focused my early clinical work in that space. When I was the attending psychologist within pediatrics at Memorial Sloan Kettering Cancer Center here in New York City, I was part of a national group, as Carrie mentioned, developing psychosocial standards of care for children with cancer and their families. And I was given the really fantastic opportunity to co-author a standard of care regarding parent mental health. And that coincided with a mental health treatment program that we were developing at MSK for parents of children with cancer. And so in that work, I was really thrust into the parent world in a different way than I had been when I was supporting parents as part of their child's care. And so I was able to separate focus a little bit and think about the parents as an individual. And certainly, as they became my patients and not just the parents of my patients, I thought I really felt that I was hearing things differently, or they were saying things to me in a different way that helped me better understand um, their experience. And that's how my interest in supporting parent and caregivers really began. And so, fast forward, I am here now with this national nonprofit organization, Courageous Parents Network. And all we work to do is to support the psychosocial aspects of caregivers of children with medical complexity and work with clinicians through parent educators to teach them how to support these parents as well. Thank you, Carrie.
Yeah, amazing. And thank you for all the work that you're doing. Um, we'll go ahead and go to Amy. Amy, give us your brief introduction since you've worked very closely with Chrissy and her network.
Sure. Thanks, Carrie, and I'm glad to be here with everyone today. As Carrie stated, I am a mom. I have four children, and I'm also a twin mom. And my daughter Lauren was diagnosed with rhabdomyosarcoma right before she and her twin sister started second grade. And my background is not in healthcare. I'm a sales manager and a project manager. And I realized that some of the skills that I had in my day job as a project manager helped me to navigate Lauren's cancer diagnosis. So I would like reach out proactively to different entities in the hospital. You know, when Lauren was struggling with mental health issues, like, can we get a psychologist? And yes, you can. When she was struggling with nutrition, can we get this? So I was proactively asking for all of these things. And then palliative care came about, thankfully, very early in Lauren's diagnosis. And that made all the difference in the world. So I am a palliative care evangelist, will be for the rest of my life, and think it's such an important part. And I hope it's part of every new pediatric cancer diagnosis. I'm also really passionate about finding ways to support not only the patient, my daughter, but her siblings and my husband and myself, and finding ways now in bereavement, but while we were actively caring for Lauren, to just, you know, get them talking about things. And, you know, children grieve at different stages, and just understanding how they can deal with what's been handed to them. So excited for our discussion today.
Yes, thank you, Amy, and thank you for sharing your story and Lauren's story and all the advocacy that you're doing. So, you mentioned getting connected with, you know, hospitals and resources and that type of thing, which is perfect introduction over into Tiffany and her work.
Yes, good afternoon. Thank you, Carrie and Amy, for sharing your story, especially, and Chrissy for connecting us with Amy. That was tremendous. So yes, my name is Tiffany Fountain. I'm an associate director of Cancer Center Partnerships with the American Cancer Society. I reside in Wilmington, North Carolina. I've been with the American Cancer Society now going on 13 years, but I've been a dedicated volunteer with the American Cancer Society long before that. And to kind of share a little bit of why in my story is I'm actually a pediatric cancer survivor. I was diagnosed with cancer when I was 15 years old. And it was in a time whenever all of these wonderful services were not around. So whenever like I think Chrissy said, whenever we started talking and coming together, we were like, this is really dynamic. And there's a reason we were all brought to the table, because part of what led me into my passion for what I do now, which in turn is, just like Carrie said, connecting resources to our cancer centers and our partners, who many I see on here. Hello, Roper. I see many of you on here. So I do partner with Roper and many other of the cancer centers within the eastern seaboard of North and South Carolina. And what that entails essentially is looking at opportunities to get the information that Amy referenced, right, into the hands of patients and families at the onset of diagnosis. And truly, even before that, we do the education, the prevention, you know, going into screening, the entire continuum of care, all the way through palliative end of care, end of life. But really, like I said, kind of just taking it full circle. I joke around all the time. I'm like, I love my job so much. You guys don't even have to pay me because I just love making sure that people have the information that they need because I know coming from where I came from back in the 1980s, yes, the 1900s, as everybody says now, I feel ancient. Um, there, the word palliative care was never mentioned, family resources never mentioned. So I'm looking forward to sharing a little bit about my story whenever we kind of get into the panel discussion on how important and impactful the work of these community partners truly are in making a difference to these families. So thank you.
Amazing. Love it. As I said, such a great group here. So, Christy, I'm going to start with you. How can providers better support caregivers, right? We often find, in just hearing the story of Tiffany, is the caregivers, the family are often overlooked, but they're deeply impacted. So, what are some of the signs that we as providers should be looking for? How can we better identify this to get them the resources that Amy and Tiffany are talking about?
hmm This is a really big question because there are different ways to approach caregiver support. So, for example, there are many centers now, and maybe this applies to some of you who are on this call, that do screen for caregiver distress, just as they might just screen for patient distress or family distress in pediatrics. That's a very structured way to use evidence-based research-backed developed standardized measures to do a systematic approach to checking in with caregivers. Certainly, I think that we've come a long way, although it's not great in terms of thinking about mental health as being a part of health. And I think that the parallel to that here is thinking about caregiver health being part of patient health, right? And so patients are given access to psychosocial supports in many centers, like social work, for example, who may get involved and assess the patient and follow them for some period of time or do check-ins. And they can do the parallel with caregivers too. So I think that there shouldn't be a lot of we don't have to silo the caregiver support from more holistic patient care. Um, and I mentioned doing something structured like a screening, but there's nothing that beats just pure relationship development, right? And developing a relationship with a caregiver over time. And sometimes that is the role of the social worker. Sometimes it's the role of physician who just makes that connection. It's oftentimes a role of nurses. I mean, nurses provide so much psychosocial support for families, both in pediatrics and in adult care. And I think, in my experience as a provider and still in listening to the stories about providers, I hear that nurses pick up and observe things and are kind of like the eyes and ears for the rest of the team oftentimes. And so I think having those interdisciplinary conversations about what everyone's seeing and creating space and welcoming that feedback and making sure the information gets directed to the right person on a team is a really important way to take care of caregivers as well. There are some initiatives in pediatrics, especially now, where clinicians are being taught and trained to just ask how a parent is doing. That is such a basic skill, but you would be surprised at how often we don't ask the parent or a caregiver, like, how are you doing? It's a really simple question. We can think about all the reasons there are barriers to that, like discomfort hearing an honest answer, feeling ill-equipped if they do have a need that we can't fill. That's a huge barrier to people asking questions and inviting feedback. And of course, time, to be frank, right? To get into these conversations. But I do think a very simple check-in is important. I will say a caveat to that is when I speak to caregivers about that notion of people checking in, which they want, and sometimes they're surprised when they do have the check-in, they do hope that if they are honest and open, that there is a resource to be given, to not just ask the question and open the conversation, but to have nothing to provide. And so, it's important that providers are equipped and this is some of the work that Tiffany does and some of the work that we do at Courageous Parents Network so that they have something to offer when a caregiver raises a concern.
Yeah, thank you. I think one of the things that I loved from that is you bring the human back to it, right? Is sometimes it's not the medical, but it's hey, I'm a person, she's a person, and it's so important. Yes, we have a hand up.
Yes, Kari, I just wanted to jump in here a minute. It just jogged my mind. Chrissy, yesterday, the child life specialist made a comment that really stuck with me that when asking the patient, the child, about their pain, and they did a pain assessment, they rated themselves higher, but when they were asked, they didn't want to say it out loud because they were worried about their parent and how children may know how their parents are doing. And I know, Tiffany, you sort of mentioned having that same feeling about your mom when you were a child. And I wonder if that's something too that can you speak to how children, when you talk about the caregiver's health impacts the patient health, if you could speak to that. Back to
Yeah.
you, Connie. I'm just sorry. It just juggled my mind right there.
No, no, you're fine. I appreciate you bringing that up. And Chrissy, thank you for all you said. And once again, just tying into just the amazing work that's being done around this. So yes, so whenever I was first diagnosed, my mom was a single mom and she was an only child and I'm an only child. So it was very traumatic for her. But being a 15-year-old, obviously, I just kind of went through the system and did what she said. I mean, I don't think it truly honestly ever she continued my care even whenever I went off to college. I mean, she was kind of in charge of everything, if you will. And whenever she quote unquote passed the torch, it was whenever I was a young adult. And so, she sat me down and went through all this and she had got me through the difficult time, right? The treatments, the surgeries, the impact that it made in my social life. And so I never really had to make a lot of decisions, if you will. But the thing that I noticed is, yes, people checked in with me all the time, the nurses, the doctors, how are you doing? How are you feeling? Can you do this? Can you do that? Do you feel up to doing this? Do you feel up to doing that? Oftentimes I'd look at her like, yes, no, as my directive. But during this period of time, I never saw her break. She never allowed her emotions to be seen in front of me because she was worried about me, and how I was doing. But the thing that I noticed is she was dwindling away after all was said and done, I can't imagine how much weight she probably lost during this period of time. Um, and I never heard anybody ask her how she was doing. Like, do you need any support? Do you need any help? Do you need, I mean, like I said, she was a single mom. She ended up, this was a long time before GoFundMe and all those different things, right? Thank goodness we had a church family. We had, a fantastic community that did come in, but that was from home. That wasn't from the medical side, that medical lens, that holistic, like you're part of a family, you're part of a unit. I'm sorry if I get emotional too. You're part of a unit. And so, whatever your child or your parent is going through is going to affect. And I, Amy can speak more to this from the sibling perspective because I did not have any. And I cannot imagine how that affects, you know, sisters, brothers from that perspective. But yeah, just listening to Chrissy and just the impact that it has, and you don't really recognize that. And now that more is being placed on that. And then just to kind of take it one just really quick step further is later in life, my mom ended up developing cancer. And she unfortunately has passed from breast cancer. But what's interesting listening to all this work is she was only 61 years old. She may still I think the advancement in all that we've done through the American Cancer Society and all the work that you guys have done through research and everything, I would like to think she'd still be here, if this had been now versus 13 years ago. But not one time was the word palliative care ever mentioned to her. And she had stage 4 cancer in her lungs, and she lived with it for 13 years. And not one time quality of life not mentioned. And so just everything has come full circle for me to be in this work and be able to provide the resources and the support to my hospital systems, to these families, to these patients, and people like Amy, that really can be impacted. And I know from a personal lens how important it is. So thank you for allowing me to share.
Yeah, thank you. And Tiffany, we're going to get to that a little bit more of what exactly these are for pediatric and adult. But I want to hit on Amy. So we talked about support, right? We hear and we keep saying the support that's needed, the support that's needed. So you going through what you went through, what does support mean to you? Right? Because it's different for everybody and what it looks like. And so for us to know how we need to check in on patients and families, but take it that next step further, what is support to you through your guys' journey, and what do you feel that was missing?
So, Lauren's cancer diagnosis was brutal and immediate. Like, we went to a appointment with her pediatrician at 9 a.m. on a Monday morning, and by 2 p.m. we had met our oncologist. Like, that's how fast our world changed. Um, and really only when palliative care got involved did things feel like they were starting to get more in control. So oncology is focused on the treatment plan and the treatment schedule and blood levels and, hey, chemo is going to be 5 days this week, 3 days next week. And all of that is so important. But palliative care talked about, pain levels and medication effectiveness and, how we were going to live with this diagnosis. I've shared this with Chrissy before. Oncology was focused on Lauren's tomorrow, which is so important. I needed that hope. Palliative care was focused on Lauren's today. They knew that she was a second grader at the time of diagnosis. They knew that she wanted to be in school. That was really important for her to feel as normal as possible. So we worked with palliative care to figure out, what were the pain meds that could control the nausea? What were the pain meds that could get her up and walking around? So I can't even tell you how many days it was chemo in the morning and school in the afternoon, just to give her a sense of normalcy. And she had a twin sister, so there was that as well. The other support was just like getting our other kids to talk about this. A cancer diagnosis is bigger than anything that had ever happened in our lives. Where our other children were, 2 in second grade. I think our oldest daughter was in sixth grade at the time, and our son was a freshman in high school. Cancer was bigger than all of those. So I reached out to all their teachers, said, hey, they're going to have more absences. They might be more disconnected in class. This is what's going on with our family. And, then I would have the kids come and be part of the clinic. I wanted them to meet the nursing staff, see who our new friends were, get to know what that clinic looked like, just to support them so that everybody knew what was going on with everyone else. And then support from our community as well. My neighbor, that people were dropping off food, and I walk with my neighbor in the morning, and I was just telling her, God, this is so great, but I feel overwhelmed. So she took it upon herself to have a meal train. And it came 3 days a week, which, people make so much and you have leftovers and such. But they continued that even after Lauren died, knowing that, we really needed that kind of support. And her teachers were absolutely amazing. Her teachers went out to her second grade teacher, both her and her twin, went out to teacher websites to say, I have a critically ill child. What do I do? Her second grade teacher had a giant stuffed dog that they put a Lauren t-shirt on, and they called it Lauren Dog. And when Lauren was in the hospital or in the clinic, another child in class would be responsible for Lauren Dog that day. And if they went to gym or to art, they would bring Lauren Dog with them. We would get pictures and videos like, hey, they were, doing a music concert for veterans, and Lauren Dog was there. And just like, the fact that they were thinking about her all the time. And that was just her teacher. So thankfully, we just had so many incredible people helping us with that. But I have to say, like, from the hospital standpoint, I met the education specialist once in July, 2 weeks after a diagnosis, and then never saw that person again. So thankfully for my teachers and in our school system, education and community support stayed. And I guess just as a parent, uh, just telling parents about, hey, checking in with them, like, hey, if education is a problem, here's the person. If finances become a problem, here's the person. If you need um, mental health resources, here's the person, you know. But you have to tell parents that over and over because it's just such an overwhelming diagnosis.
Yeah, what a powerful story. I wish we could bottle up 99% of what you just said and just keep that with us. Some really powerful statements, and admiration to you and your whole family, and the support team that was behind you. So thank you for that. Um, Tiffany, going to that, right? She continued to mention everything. And so, with your line of work, your team that is behind you, how can healthcare teams better connect patients to organizations like the American Cancer Society early in their journey, right? We heard that a lot, is that we needed it early on. Amy spoke to how rapidly their world got flipped upside down. So we can't wait for these things to come in. And so I'd like you to speak to that if you can, both from a pediatric world, and then certainly if there are differences in the adult world as well.
Yeah, of course. And just to, you know, Amy, I just love everything you just touched on. I mean, it's just interesting. It kind of, I just want to just share this as it takes me back to that period of time in my life too. As I said, much different world then than it is now. But it was the summer. I was getting ready to be a junior in high school. So I found out I had cancer a week before my 16th birthday. So it was a very, very interesting time. Um, and just the difference, and then I don't want to say normalcy of where cancer is now, but I missed the first 8 weeks of my junior year of high school. And whenever I came back, especially for somebody of my age to be diagnosed with cancer, I noticed my friend group had shrank. People were kind of standoffish, and they didn't know it's not contagious. It's not, you're not going to catch it. It's not, and I didn't understand. So I had those conversations with my mom, and my mom, explained to me how they may be feeling and not knowing what to say, and things such as that. But once again, I just love that it was embraced, and the love that they showed for your daughter, and your family, and with Lauren Dog and all the different little things that it let her know that nothing was wrong with her either. Because I think that's oftentimes whenever you're looking at that pediatric lens, because you haven't formed all those adult thoughts that the wisdom that comes along with that adulting sometimes. But anyway, I digress. Carrie asked me a very important question, which I do want to share because that's why I am here, is to share about some of the connectivity and resources with the American Cancer Society. And like I said at the beginning of this conversation, that's why I love my job so much. I can speak from that personal perspective of all the wonderful things that we now have to help fill those gaps that I was just talking about. Um, but really and truly, going back to your question about the healthcare system and the American Cancer Society and organizations like us in the community, I think it really starts with introducing those resources that we have to offer at the beginning. Like I said, from the diagnosis, I mean, we can talk about education, prevention, and all that, but really, once the diagnosis has been made, having those resources accessible and readily available. So that way it just kind of becomes a part of the cancer care that they receive instead of kind of an add-on. Like, oh, they're needing this now. Where can we find it? And really that comes from, I feel like personally, communication of the healthcare systems and those teams, knowing who in the community they can depend on, who has what resources. Like for the American Cancer Society specifically, I connect with my cancer centers, I connect with my systems, and we have other pillars within the American Cancer Society that's connecting with our federally qualified health centers and our community partners, because we want to make sure that we have that partnership, and that our health systems are aware of what we have to offer. Because that's the other thing that I really, really like to instill and let people know is we're not a one size fits all. The American Cancer Society cannot meet every single need of every single family of every single cancer patient. So that's why we have to also rely on those other community partners and form those relationships with them. Because if somebody came to me, we'll use Roper since they're on the phone. Say Lori came to me and she needed something, and I was like, oh, the American Cancer Society doesn't offer that, but XYZ over in, Greenville, they do. So here's their information. So that's why I said I think it's just so important to make sure that our healthcare systems are aware of the resources that are out there and making sure that they're built into that first onset of diagnosis from the very beginning. So then they'll have that information that they can then provide to the patients and the families and the caregivers. So
Amazing. I'm going to keep you here for a sec.
sure.
You talk about, part of what you do is the accreditation, right? So this helps influence the quality and consistency of it. Talk a little bit about that and your guys' role of the accreditation with certain healthcare systems, hospitalizations, and all of that.
Sure. And let me just establish, so I don't actually do the accreditations, but I'm part of it. I'm kind of a liaison, if you will, for the Commission on Cancer. I'm not sure how many of you are familiar with that, but it's an accreditation program for the cancer centers through the American College of Surgeons. And there's different ones. There's actually a pediatric accreditation program for the pediatric programs, since we have been talking so much about that. But basically, what the Commission on Cancer, how it came into being, is they really wanted to develop a kind of a standard of care across all the cancer programs. So because they were seeing, going back to, like I said, the research and all the different, modalities that were coming out, and all the different treatments and all the different, cancer care was kind of all over the board. And you could go to one cancer center and get a completely different cancer plan than if you went to another one. So the Commission on Cancer through the American College of Surgeons created this standardization program, this accreditation program, if you will, and it really kind of reinforces that lens of standardized care, consistent quality of care. And then also the thing that I love the most is built into these different standards that they have. There's multiple, and the cancer center has to go through meeting these standards, whether it's quality improvement, operative standards. I mean, there's even standards that the surgeons have to make sure that they maintain. But the thing that I love the most is we're talking about supportive care, right? That is not, they're not remiss in making sure that those are out on the table too. So they have standards that they have to meet with nutrition, rehab, psychosocial screening, navigation. We know how important navigation is. Um, all of that is a core part of and built in. Like I said earlier, it's not an add-on, if you will. It's part of the cancer plan and part of this accreditation program. So anyway, like I said, not all cancer programs are accredited. It is an optional, for a cancer program to become accredited through the Commission on Cancer and the College of Surgeons, but is highly recommended because it is a standardization that you can depend on when you go to those cancer centers. And just to reset the original question that you mentioned, Carrie, is the Commission on Cancer and the American College of Surgeons has a strong and longstanding partnership with the American Cancer Society. And so we're looked at as a expert and a resource to help make sure that we support those cancer programs who are accredited so they can maintain that accreditation process. So we attend those meetings. We have sidebar conversations about, things and different various initiatives and goals that they may have for their programs. So it's a great partnership, and it's also that opportunity, kind of full circle again, kind of listening to, because they're not all cookie cutter. A community-based cancer center may need different support than an NCI like MUSC in Charleston. I know we're based out of South Carolina here, so talking about the NCI center. So, it's really about knowing who you're talking to, being at the table, listening to them, and figuring out where we can partner and support. And that looks very different for pediatric care too, which we've been talking a lot about. So yeah, so that's kind of what that looks like.
Thank
I
you.
hope that I hope that answers that question.
Yeah, no, and I want to dig into some of us as providers. How do we help advocate for that? But we're going to get back to that part here. We talk about early access, so making this part of the care at day one, not waiting until we identify issues or needs, right? So, Chrissy, I want to talk to this. There's, a lot of us, we're talking in the serious illness world, but palliative care, how are ways, right? Palliative care, just like hospice, can get this really bad negative connotation to it, right? So, how do we introduce these conversations early without causing more fear and distress? And, Amy mentioned the important part of living today and symptom management. We know another part of this, and I'm going to let Amy speak to it too, is difficult conversations. And so, we know the importance of having it, but how do we approach that, especially with parents and families, whether it's adult or pediatric, without instilling that fear and distress?
I think that when we talk about communication, we always have to begin with ourselves as the communicator. And if we want to come across and deliver something confidently because we believe in ourselves what palliative care is and how it can be helpful, then we really have to believe it ourselves to begin with. Because many of us, myself included, also trained or were in environments of that misconception where palliative care was essentially synonymous with hospice care. And I think on a personal level, I learned that factually that was inaccurate, but it took me some practice and some confidence building to believe it because I was trained in a very different way of thinking about it. So a little self-work goes a long way, I think, when it comes to communication. Um, and then the belief in what it really is helps us to deliver with more confidence what it really is. And I start off when I introduce the idea to people, whether it be in my own practice or in larger settings, um, speaking to a group of parents, I just name the elephant right away. And I say, you may have heard about palliative care before. And if you have, you may believe like many other people believe that it's the same as hospice, but it isn't. I'm going to tell you what it is now. I just go right for it because I want to get ahead of it immediately. And then I say, here is what it can do. It really is about reducing suffering of all kinds and improving quality of life in all domains. Let me tell you what that is and give some concrete examples and say, I have known parents or patients in the past that have used palliative care to help with nausea medication, to help convey news to a family member, to help fill out forms so that you can get a service in your home. You give really concrete examples of all the ways. Um, that are not associated, frankly, with end of life as the introductory conversation. I also encourage people to bundle it when they talk to new families about the services that are offered at their hospital. We have the educators, we have psychology, we have these palliative care folks, we have a chaplain, so it doesn't feel like it's a different service that is so unique and special and untouchable that it's part of this menu of things, and hopefully hospitals have at least a few items on their menu of what we can offer to you as a family. But I think my personal view is just directly addressing it right off the bat is a great way to do it. And then there's a lot of great materials that they can take and read on their own for digestion. So at Courageous Parents Network, we are huge, huge, huge advocates of pediatric palliative care. We're actually the only organization to sit on the American Academy of Pediatrics section for hospice and palliative medicine. We have a lot of resources that speak to this in language that is easy to understand about what palliative care is and isn't. Marisette mentioned CAPC earlier. That's a great resource in the adult space. But there are many of these resources out there. And there's also videos of people with lived experience. So at CPN, we have tons of parents and speaking to this, but you can find videos of adults speaking to this as well. It's another form of learning for us to hear straight from someone who's been there, who can, to piggyback on Amy's comment earlier about being an evangelist, but who can testify to the benefit of palliative care and the real spectrum. The other thing that I think is a common misconception in some areas is that people, once they're on palliative care, they don't come off palliative care. That's sort of like some language that's developed. And I think if we can also move the conversation to this being a specialty service, just like GI, just like, cardiology or whoever we bring in as a specialist, that they are around when you need them. And then if you don't need them anymore, you don't need them anymore. Right. And so if we can also shift, like it's not like you're on that and it's inevitable or that it predicts the decline. The other thing, and research backs this, is to address the misconception that introducing something like palliative care or hospice care hastens death or reduces hope, because that's another unspoken worry or elephant. And I think that we have enough good research on that. We can just say it, right? Like, our responsibility in supporting caregivers is not just always making sure they have the lights on and tangible services, but it's anticipating the worries, like the unspoken concerns that we all as providers have enough expertise to know they're thinking about. We can address it and put those things on the table. And I think that's really worthwhile.
Yeah. Love that. I think, to your point of one of the biggest misconceptions in healthcare providers is the fear of response, right? And so then we become hesitant in what we're willing to talk about or share because we don't want to take away hope. We don't want to, build distrust in the relationship. So Amy, that's going to move right into you and just, how can care teams, you living through your experience, how can we better from a palliative team, all of those things, how can we honor the voices of patients and families in decision making? That's a big part of palliative care and the support systems that we're building with the American Cancer Society and Chrissy's work. From your perspective, how can we do better at that?
So I think the way healthcare specialists, and especially the oncology department, I think they viewed Lauren as a pediatric cancer patient, and I viewed Lauren as my daughter who was diagnosed with pediatric cancer. So kid first, cancer second, and I think that's for adults too. Person first, cancer second. So I wanted to prioritize the things that were important to her, and then needed the healthcare team to help me support what was, her objectives to be a normal kid, to get to school as much as possible, but also our family objectives. We didn't know how this would turn out, but we wanted to kind of cram as much living as we could in that. So, that meant, having birthday parties, taking vacations, trying to figure out how treatment runs in parallel to that. I also want to just talk about the communication piece. I think that's so important, what Chrissy was saying. I needed the healthcare team to recognize kind of aspects of Lauren's personality. She's a gifted worrier, like worried on a college level, like AP worry class. And so I needed like the healthcare team to recognize that. So honesty was so important in all of the communications, but it wasn't the whole truth and nothing but the truth. Lauren didn't need the whole truth. She needed truthful information, but not the whole truth. So we had a deal that hard conversations and scary conversations were held outside of her room. So I told her when she was little, like while she's in the hospital, she's like Taylor Swift. I'm Taylor Swift's manager. Taylor Swift only has to deal with important people and people she wants to see. So if her doctors came in, they talked to her, and those were important conversations. But if it was, a medical student or an intern or somebody else, like I would have those conversations in the hallway. And that was twofold. It was to relieve her worries, and then it was so that I could kind of preface that first and find out what they were going for and what their motive was. So that helped us a lot in our communications and making her feel supported. And then piggyback on Chrissy's how she approaches conversations. My husband and I also did that with our other kids, like to encourage them to talk. We would say things like, "Boy, you must feel really frustrated that all the attention's going to Lauren. If I were you, that would make me really mad." Or, "This day must feel really sad to you because we were planning to do this, and Lauren got sick and we had to cancel our plans." So it was kind of like anticipating what they were thinking about and giving them the permission, like, if I were you, I would be so angry or frustrated or sad about this. And then they're like, "Yeah, I am, and this is why." So it just helped to kind of, when they weren't ready to express it, it was like, "Hey, can I help you express that?" And giving them permission to do that.
Wow, amazing. Someone in the chat box said we just need to clone you, and I wish we could. And again, the work that you did and continue to do is really cool. We are narrowing down to time, so I want to make sure we get to some other questions, then open it up for anyone else. So I'm going to ask this to everybody and to the three of you. So if you could implement one change tomorrow to improve our collaboration in cancer care, what would it be? Or what is one message that you want the audience to take from this today? So Chrissy, let's go ahead and start with you.
This is an easy one for me. So, I mean, there's lots of things, right? But the thing that floats to the top of my mind is working with those with lived experience from the ground up. That's why I joined Courageous Parents Network, which is a parent-run organization. I'm the only clinician that works amongst the team of parents who are, who have been there. Um, as I mentioned earlier, my inspiration to support parents really came when I started hearing them differently, back when I was delivering care in a hospital. And it was like a light bulb moment where I was like, oh my gosh, these are the customers and they are not being well served. And if this were, a Nike, they would be asking the runners what they need in their shoes to be faster runners, right? And so that just goes across the board, in my opinion, in healthcare, not just in pediatrics, but all the way, So there's research projects that can integrate those with lived experience from the ground up, like at the time of conception, not like we're going to develop a study and then get feedback on it. Advocacy efforts, certainly program development. Um, Asking, this is why we have Amy here too, right? Like bringing caregivers and others with lived experience in the conversation and saying, hey, what do you need? And that can be done on a big level, like a national level, but then also needs to be institution specific too, because the resources and systems do have their own nuances and not all can do things in the same way. And so, that's where I would begin, is bringing those with lived experience. And one, because you need their expertise, but also they get stuff done. I can tell you, they've got the energy, they've got the fire. Working with parents has been the greatest joy because we can move much more quickly together, in partnership than without.
Yeah, thank you. That's great. And I heard a lot of we in that, right? And I think that that's what we take away from this too, is it is not us, it is not you, it is not I, it's we, because that's the only way that we can get to where we need to be. So I love that. Tiffany, I'm going to let you, do you need me to repeat the questions or you got it?
I think basically one change that we could implement if we could. I know that I'm going to continue to say this, but it's that communication piece, and especially from that community care lens. If you could find that direct point of contact in the community, whether it's the American Cancer Society, Courageous Parents, and they're going to be different, right? But at the same time, just going back to what I said about me, if I had one of you contact me and you needed a resource, and I know the American Cancer Society cannot provide that resource, I would do everything I could to try to find that resource for you and make that connection. So that way it takes the burden off of the patient or the family or something as well. And I think that's it. It's just kind of that spider web approach, if you will. Those shared referral pathways, just from the clinical community and the community partners. I know here in the Wilmington, North Carolina area where I live, I actually worked with the Cancer Center here, and we've created what's called a Cape Fear Cancer Collaborative. And essentially, what we did is we invited every single community partner and healthcare organization that touched cancer patients in whatever fashion. And we brought them to the table. We brought the navigators to the table from the cancer centers and the social workers. And we looked at them and said, what do you need from us? We asked them kind of what Chrissy was saying about Nike and going to the patients. We also went to the navigators and the social workers and we said, what do you need from us to help? We know you're overworked. What can we do from the community lens to help support you as you are supporting the patients, as you're supporting these families? It was an eye-opening experience because what we found is some of those gaps and those barriers in care that they were seeing were like, wait, we can do that for you. Did you not know we can do that for you? And they were like, no. So they were like, well, give us a directory. Can you give us somewhere to go that we can find all the resources? So that's kind of our goal now. We're creating a directory for the local navigators and the social workers that have all of the community partners listed and what they do specifically. So that way they kind of have those touch points to, take it back to what I said, that point of contact. Because I think it sounds really trivial, but you don't know what you don't know. And if you're not aware that there's even a resource out there or where to go to try to find that resource, and even if you just have that one point of contact, whether it's a Chrissy, whether it's a Tiffany, whether it's an Amy, it doesn't have to be somebody in the healthcare world. Just have a person to go to at the onset, just to make sure that you're having that connectivity to know where to go to get the support that you need.
Yeah, thank you. I see that they had posted the link for the Courageous Parent Network. So if you guys didn't see that, make sure you take a look at that. But to speak to that, Tiffany, is, I think that's where we as providers and clinicians sometimes get stuck, is we want to point them in the right direction. And sometimes we feel like we only have the same resources that, Google, and we start looking things up. And so, what is your advice on that for us to say, okay, we want to find where we can go for resources, point us in that direction?
Well, call me if you want, or any of my ACS colleagues. Go to cancer.org. That's the fantastic thing about us, is because we are like all cancers nationwide. And going back to what I said, I mean, we're not an end all be all. I mean, we don't do everything, but we do partner with other organizations and we list them on our website. It's under Find Help on our website at cancer.org, and I can drop that in the chat in a minute as well. But you can put it in a zip code. You can look at it from like a food insecurity. You need to know where a food bank is. But then, as I said, there's still something um, to be said about having a person. A website's great, it's fantastic. We have tons of resources. Our ACS Cares app is amazing, and you can go on there, you can connect to all the resources, you can connect with volunteers. But I think still having that person, you always want a person, or at least I'm of that age that I want a person. So as I said, if call me, I'll put my information in the chat. If you don't know who to call, I'll find somebody for you to connect with. But I think it's just having an advocate, finding your advocate, whether you're a physician, whether you're a parent, whether you're a patient, whether you're a colleague, whether you're a community partner and friend like Chrissy. I think it's just having your person that you can count on to help you find what you're looking for. So yeah, and I
Tiffany, if I
mean,
can add
oh
to
yeah,
what you're
go ahead.
saying about that
Yeah,
personal connection, um, you all have departmental meetings, right, or weekly team meetings. Something that we do often at CPN is we present at those meetings.
exactly. Yeah.
And I would invite, if you find an organization, just invite them to come for 20 or 30 minutes to give the spiel of what they do, really concrete.
Oh,
Then you have the contact and they've educated you like really quickly, A to Z, what they can offer. Because none of us have time over analyzing and having questions on websites, to Tiffany's point. Like, I think that's a really good use of time as a team. And that's a great way to kind of know who you're referring families to.
Yeah,
and
thank you so much.
exactly. We do those in services as well, and
Yeah.
it's just like a quick snapshot and overview of everything that we do, and that's a great way to kind of just embed that. So
Yeah, that's so helpful. And in the chat box, Annalise posted she is Tiffany's counterpart in South Carolina. And so she works with upstate and the Midlands, and happy to connect. So you guys are going to have us on speed dial. So
we welcome it. That's what we're here
yeah,
for.
no, and we love the support. So Amy, you're up. So what could you, if you could implement one change to improve the collaboration, or what is one message that you want the audience to take away?
Um, I cannot stress enough how impactful palliative care was in our journey. I just don't even know what that would have looked like. It brought hope, and it brought realism, and it brought healing on so many days of our journey. I still lean on that really heavily. So I really encourage, like, any cancer diagnosis, adult, child, it doesn't matter, get palliative care involved early. They're just such special people. And then, just like a side note, if I may, Carrie, for all the healthcare workers that are dealing directly with caregivers, like, catch a caregiver doing something in the act. So I'm thinking about a particularly hard day. I was in the hallway, kind of crying, just completely overwhelmed. And our clinic nurse, Noelle, came out and she said, "How are you doing?" Asked that question, "Are you okay?" And I'm okay. I'm okay. And she said, "I just want you to know, we all think you're doing a really good job. Like we all think that about you." And then I told her thank you. I asked her to go check on Lauren, but I can't tell you how many times I replayed that in my head, that conversation when I was having my doubts. Am I doing the right job? And as a parent of a critically ill child, like that's all I wanted at the end of the day was to be the best parent I could. So if you can catch that parent doing something something good, they really lean on that. And I just want to thank you. Always a good day to be able to talk about Lauren and all the things that we experienced. And we promised each other we would make cancer better for the next family in line. And I feel like today I was able to keep that promise to her. So thank you.
Yes, you more than exceeded that, and I have no doubt that you'll continue on that. We do have a little. Are we at 1 or 1:30? 1:30, correct?
Yes, ma'am. You have some time. There may be some
Okay,
questions.
perfect.
Yep.
A lot of this, I want to get to questions, but we did hit a lot on, what to do during the active, diagnosis treatment plan. There was a lot earlier in the week that unfortunately I couldn't join, but that was on survivorship. And so just briefly from any of you, do you guys want to speak up to the importance of, we briefly talked on Amy about that need, but what does survivorship or bereavement look like in this world? And how can we as providers better support it?
Um, I can speak from the lens of helping and also being a survivor. I will say, being a pediatric cancer survivor, you experience a lot differently later in life if you're fortunate enough to, come through your treatments and experience the longevity that I've been so gratefully given, if you will, um, because you live with that cancer survivorship longer than if you developed cancer, at 50, 60 years old. So a lot of the side effects from your treatments present when you're much younger. And that goes back to kind of what Amy was saying about that palliative care piece, because that's what it falls under. It's still that quality of life, and it gets lost in translation. I can speak to that personally, because it's very rare if I still have to go for checkups, once a year and sometimes more frequently, depending. Um, and they never ask like, how are you managing, are you experiencing any side effects? Are you, what is this like? How is this happening to the point that I actually have to go look for resources myself on my own and find them. From the, lens of the American Cancer Society and that survivorship piece, I think oftentimes what happens, and survivorship is a huge part of that Commission on Cancer accreditation process that I was speaking to earlier with the cancer centers, because it's recognized that it's almost like what Amy was saying, those different pockets, right? You have you're in treatment, you're doing this, you're now in palliative, and if you're fortunate enough and you're released, and you're in remission, you're out of treatment, and you're a survivor at that point, and then it's just dropped. Nobody says, well, now what, well, the Commission on Cancer recognized this, and they were like, wait. The survivors are still part of this trajectory. They're still on a journey. They're on a very defined journey too, because they don't have that clinical team at their ready. They're not going to their doctor's appointments anymore, probably as frequently, if you will, and having that connection with their navigators and their teams. So it's even more important for them to have the support and not get lost in translation or dropped in the system. So having those built out survivorship care plans, having those survivorship programs, having those support mechanisms for those survivors to kind of teach them what it's like to live even in remission, but to live with a cancer diagnosis. And, I can't speak highly enough. So once again, making sure you're relying on your community resources, doing your due diligence to make sure that whenever you have a patient who's been released and are going into their survivorship, that they have the information that they need to continue to feel empowered, to feel like, they're a person and they're entering society again. And here you go to be a success at that. So I hope that makes sense because, like I said, I can look at it from both lenses, and it's a unique place to be.
Yeah, absolutely. And in the community palliative world, right, and the healthcare world we're in, is we run into that of, okay, we've gotten there, and now what's the long-term treatment plan? So knowing that piece of it's super helpful. Amy, you're obviously coming from a perspective of bereavement, and so what does that world look like? I know you talked a lot about what you're doing to advocate, but what can we do for you?
It is, I got to say, it's a lonely place to be a bereaved parent because um, it was. I'll give you an example. It was very interesting. Have worked at my same company for a long time. I had coworkers that knew about Lauren, and after she passed, did not mention her death. I took a couple months off. I came back, like her name was not mentioned. My mom happened to die the year after, and I got sympathy cards from these two particular coworkers about my mom. So it was like they could handle my mom dying because that was expected. They could not handle my child dying because they just didn't know what to say to me. People are worried that they're going to make me cry, that they're going to, trigger me in some way. And that's not possible. I think about her every moment of every day. I think just in the US in general, we need to get better about grief and dealing with grief. I find like social media is actually pretty helpful to me that way. There are a lot of great Instagram accounts, and that's where I tend to go just to hear about grief theories and what people say and things like that. I also think like as a parent, it's really important to keep checking in with my surviving kids. Like, are you okay? I set them up with therapists on and off, and it's up to them, at the ages they're at, what they want, if they want to go. But they're all very good at therapy, thankfully. And but I think it's important to give them an outlet that's not my husband or myself, so that they can talk about, hey, it's really hard to be, a, a bereaved sibling because my parents are really focused on it's hard for my parents. It's hard to hold joy and grief at the same time. It's hard to celebrate the you know all the things you should celebrate about your surviving children and hold grief at the same time. So that's been a challenge. I'm sure it'll be a challenge for the rest of my life. But yeah, it's pretty challenging. But I'm glad for these kind of opportunities and for CPN to talk about those hard topics and to be able to kind of talk about the elephant in the room.
Yeah, thank you for sharing that. Chrissy.
Yeah, I really appreciate what Tiffany said about the continuity of care into survivorship. Um, We're still really far behind, though, on where we need to be in terms of programs that are developed to suit the needs, in my opinion, of both patients and the family members and those affected. And so I wanted to touch on the like, what can we do today in the meantime sort of thing, in addition to what Tiffany said about external resources. And I think um, this goes along with what I said earlier about anticipating what parents or caregivers might be worried about or be wondering about. We also know a lot about what survivorship looks like for these people, and we can provide really good anticipatory guidance to caregivers and to patients about what the transition might feel like, right? We know it's common, I know this from the pediatric world especially, that parents are worried because when the chemo was keeping the cancer away, and when I stop it, now I worry it'll come back, right? We know that scans are like a horrible thing to go through, and it's every 3 months for like a really long time. Like we can have ways of saying it is normal for you to worry about this. It is normal to feel uneasy about this. We understand that you're still on, to Tiffany's point earlier, like the journey, because there is, in the well-intended social supports are saying things like, "Oh my God, it's over." Like we should have a party with a cake. And a lot of institutions have patients ring a bell. Some people are really, really don't like that experience of ringing the bell. Some do, some don't. Like it resonates with some, but not others. And I think we can just normalize the experience of what's to come as well, because we don't want people to feel shocked by their own emotional experience. They don't need to be. They may still be, but we can do our part to kind of help them during that transition in that way. I think I had an old supervisor very early on. I adopted to something that he would say to parents, which is that like you're not going crazy, but the situation is so crazy, right? And so we want people to know that their feelings and that emotional reaction at all points, even when they feel the external pressure to celebrate the end, is normal for that to come with a mixed bag.
Yeah, thank you. I hear a lot of normalize, right? And then still going back to this anticipatory piece. So what can you expect during and what can you expect after to help best prepare patients and families? So awesome. Anything else? I'm going to open up for questions, but is there anything else that you guys would like to talk about, to hit on before we open up to questions?
If I may, just from a personal perspective, I just want to say, Amy, this has been kind of cathartic for me to sit here and listen to you speak from a parental lens because as I said, I lost my mom to cancer. She was only 61, and I had a young child at the time, her grandson, who that's a whole nother thing. I was never supposed to be able to have kids and feel so blessed that I was able to have him. But he was young at the time. He was 10 years old, and I did not realize the impact that this probably had on her, once again, going back to that supportive care until my son turned the age that I
That you
was
were,
when I got
that you
cancer.
were. Yeah.
And when he did, it gives me chills now to talk about it. I was like, I can't imagine what her world was like. I can't imagine what she was going through. And she's not here for me to say that to her. So I'm just going to say it to you. You are an amazing mother and an amazing mom in everything
Thank
you've
you.
done, your journey and your path. And thank you for sharing. Because I want to say thank you. I mean, to all the moms out there and the dads, and I'm not discrediting the dads. Love the dads. Um, it's just, the moms are special. And so
Thank you,
but
Tiffany.
thank you for
That means a
sharing and
lot.
being so transparent and just open.
Thank you.
But other than that, I would just want to go back to, as I gotta put my work hat on, obviously. Is just please lean into your community partners, ask questions. And there's never, as they say, there's never a stupid question. If you're uncertain of something, if it even exists, just find that point of contact. Like I said, if I cannot say how important that is all of my systems that I've been working with, I've been very fortunate that most amount I've been working with them since like 2016. They just pick up the phone, they'll text me, they'll call me and like, hey, this is what I'm in need of. How can I help you? Or I mean, how can you help me? Sometimes they help me too. But just knowing that there's somebody out there that you can connect with. I just want to wrap that up by saying that. So
Perfect. Thank you guys so much. This was really, really awesome. And I mimic everything, Tiffany, that you had just said. And, to speak to Tiffany and Chrissy, the work that you guys are doing is the same thing. Thank you, thank you, thank you, because we could not do our jobs as clinicians without the support that you guys are doing and the advocacy that you bring to the table too. So, all right, I'm going to open that up for questions. I'll kind of look through this chat box and see if there's anything. I think a lot of resources in there. But any questions that anyone has, please speak up. You have the dream team here.
Um, Carrie, I don't really have a question, but I mean, I can't do as many heart emojis as I want to do for this whole conversation. Um, I mean, and I didn't know that about you, Tiffany, and I've worked with you for years. So thank you for sharing those details about things. And now it tells me why you're so on top of it and it's your passion. And Amy, I mean, I don't know how you learned to be that amazing of a parent and where that came from and all the different resources and things you looked at. But so grateful for hearing that from you and how simple it is to ask the parent or a caregiver of our adult patients. Um, and then also Chrissy and all of, just humanizing the answer of how are you to the people that are around and supporting the patient and part of that team. I just really enjoyed it and it really reaffirmed my team here in Charleston and then people that work with me at Roper. I'm sure they get sick of me because every time I come across a resource, I group email them all the resource. I did it this morning. I'm sure they're like, there's another damn email from Lori with some link. And even with this virtual symposium, I probably sent it 10 times since we got all the stuff to make sure people would get on it because I felt like it was good information. But I just so appreciate people and passion and, Amy, the things you said about hope for, when we talk to oncologists about referring to palliative care, because I work with the palliative care team, they don't want to take the patient's hope away.
I
And
know.
my argument is you're not taking hope away.
No.
You want to make it so that patient and family can continue to get the treatment and tolerate what you're asking them to go through so that
Yes.
they can get to that end of that treatment and that next phase of what's happening. And so just the way you said it, that oncologists look for tomorrow and palliative looks at today, that was a whole, I mean, I love that. Thank you. So I really appreciate it. And this was so beneficial and just, I loved it, the whole conversation. So I'm going to let anybody ask questions if they have.
Thank you. I'm just going to reframe your coworkers aren't sick of you bringing resources to them. They know that you are the person to go to when they need a resource. So they know that, she sends it and I know who to go to with a tough question. So know that about yourself.
Mhm. And I just want to echo what Lori said, Amy, your transparency, the inside lens that you gave us to see, into your world as a parent. But the statement you made about the focus, I think is great for adults as well, for adults that need to have palliative care. That the heart specialist is thinking about tomorrow, but the palliative care team is going to be working with this advanced heart disease patient today. It could be dementia, it could be any kind of illness. And the way you frame that is so powerful that we're going to be echoing that statement over and over and over again. And Laura, you're just going to have to get your folks to listen to this particular session. Your oncologists need to listen to this session because definitely there's a lot of misconceptions, even with our physicians, about palliative care. And in my own personal story, and this was years ago when my mom was diagnosed with cancer, the oncologist couldn't even talk with my mom to let her know that she was dying. She knew it, but he never had the conversation with her. And so, and we still are struggling with that today. And we've got to get better. It's okay, Chrissy, like you said, let's address the elephant in the room, but we can do it with compassion. We can open it up so that there can be dialogue. And so, you precious ladies today have really done that for us today, giving us some really good tools that we can use. So thank you.
I was going to say something that Marisette that you hit on, and I dropped this in the chat, but I'm not sure if anyone saw it. But and I know my colleague Annalise is on here as well. It is so fascinating to me how many clinicians do not understand palliative care. I mean, it astonishes me to the point that we're doing palliative care education for our health systems. And when I say we, ACS. Um, and so that's part, once again, I saw Chrissy about the pediatric program too with the Commission on Cancer and so the palliative care that was just put into the standards a couple years ago. I think now my time does run in, so it could have been 3 years ago, but it hasn't been in there forever because it wasn't like talked about, it wasn't known, it wasn't available, and nobody, and now that it's coming to fruition, people still get it confused, and it's baffling to me. So please have those conversations. Please use all the wonderful resources that are in there in your communities, in your hospital settings. And Lori, talk to your doctors and say, hey, do you know what palliative care is? If not, I'm gonna send you some information. Information is power, like I said. And just make the conversation, normalize it because it's so important. It's so important.
Just
Yeah.
a really nice, heartwarming thought here as a result of Lauren's experience with her palliative care team and how impactful they were. Because of Lauren, now there's a palliative care consult with every new pediatric cancer diagnosis in her hospital. So I remember one of her oncologists came to me and said, do you really think this is working, the palliative care link? And I'm like, can you not see this? Can you not see how much better she is with this team behind her? So my family and I are really proud of that legacy that she left.
Wow. Well, if that is not a way to end palliative conversation, right? Chrissy, did you?
Oh, I was just going to say, see, I told you parents get stuff done.
Yeah.
It's those with lived experience that make things happen. You have to partner.
Yeah, I'll never forget. This wasn't that long ago. I called a nephrologist, and there are people in my local area, so we will not name names, but I called and I was like, hey, this is Carrie Bradford with palliative and calling for da 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 da. And his response was, why are you calling me if the patient is on hospice? And I was like, well, because he's on palliative and let's talk. But just to that point, we have so much that needs to get out there. Palliative care is a wonderful world. And like it was mentioned, we did talk a lot about pediatrics, but all of these are tools, conversations, support, really important information that really applies to all aspects of serious illness and not only in the pediatric world, because it is a lonely world. And so, we talked a lot about normalizing and humans, and we always think that it won't happen to us. And this is living proof that it has happened to all of us, right? And so, knowing what is out there, knowing the support that is there is really important. All right. Any other questions?
I don't see any other questions in the chat, so I'm going to ask Jessica if she will put the evaluation link up. And I do want to share one of our folks who had to drop off early said this was an amazing session, and she was wanting to make sure she could get the link emailed to her so she could do the evaluation. So I told Jenny we'll get it to her. So anyhow. But thanks, everyone. Back to you, Carrie.
Marisette, to be clear, this has been recorded, right? We're all going to be able to share this with the people that we know need it, which is like every person in healthcare that we know and love needs to listen to this. Every single one in every institution.
Absolutely, Mary Lou. It is being recorded. Yes.
Okay. Thank you for your amazingness, ladies.
And Marisette, it'll get posted on our website, right?
It will eventually, yes, get posted on our website. Yes.
Thank you.
And we'll send that out to everyone who registered. They'll get, the link and the notification that those are posted. So yes. So the recording, and if there were any slides for any of the sessions this week, we have one more day to go, which is tomorrow. So we're gonna have the final wrap up on tomorrow. So yes.
Yeah, same time tomorrow. Reminder that pain management and holistic supportive therapies with Dr. Judith Pace and Michelle Robinson. So will be a great session.
Thank you, Marisette, for putting it together.
Oh,
thank you, guys.
Teamwork. Thanks, everyone.